energy, evolution, bringing with it the power of nature, life, and a new birth. Molecules and cells changing into a life form. From conception onward, the human brain's structure and function are largely dependent on movement. During pregnancy, fetal movement is especially essential for progressive neurological development following birth. But sometimes, things can go wrong. Programming the dysfunctional brain. There probably couldn't be anything more devastating to an individual than to see a loved one struggling for life. We ask ourselves, what went wrong? Perhaps your loved one was diagnosed with a birth injury, cerebral palsy, acquired cerebral palsy such as a traumatic brain injury due to a vehicle accident, a fall, a near drowning, child abuse, or a sports injury. The nature of all brain injuries is similar. But what are your options? First, realize that the brain is the greatest of all computers. But like a computer, a brain needs input to function properly. That input comes into the brain through sensory information from our surroundings. The information travels along sensory pathways or one-way routes, and it is transmitted via synaptic connections directly into the brain center responsible for a given function. For example, when we hear a phone ring, this is called sensory input. When we answer the phone, this is called motor output. Quite simply then, sensory input usually means motor action out. Let's look at how sensory input impacts the brain through its 4 sequential stages of development. The first level or stage of development involves the spinal cord and the medulla. It is at this primitive level that the individual begins to have involuntary and random movement of arms and legs. He hears sounds and startles at a loud noise. He begins to differentiate brightness from darkness. For example, he squints in bright light. Information begins to be processed through touch as he grasps any object once the palm of the hand is stimulated. In a well brain, at this first level, constant sensory stimulation or input is accomplished quite naturally as the individual navigates his world. As this sensory input proceeds, the brain continues to develop, moving to the second level, the pons. Threatening sounds will cause crying. One begins to differentiate through touch, sensing uncomfortable or painful stimuli. The ability to release a grasped object becomes functional at this level. When all motor pathways are connecting, the individual begins to crawl in a prone position on the belly. As sensory input continues, the brain becomes more developed, moving to the third stage, which is the midbrain, or the mesencephalon. It is at this stage that the individual begins to defy gravity. He raises and supports his body weight on his hands and knees. After practice, he moves forward, unbalanced, then ultimately creeps in a smooth cross-pattern movement. Vertical visual tracking skills develop, along with the ability to identify things in greater detail at his level. More vocalization takes place and speech begins to develop. The individual becomes extremely aware of meaning, changing in tonality of sounds, especially voices, and enjoys pleasurable touch and tickling. At this time, greater skill develops in holding objects. This is known as volitional, prehensile, grasping ability. These 3 levels prepare the way for the more sophisticated cortical stage. At this level, an individual movements become more coordinated and is ready to perform more complex bilateral movement. Speech becomes more sophisticated, and the processing of information through reading takes place. The ability to understand things logically occurs, and a fully functioning human being begins to emerge. By enriching an individual's sensory input and allowing constant opportunities for practice, a person can achieve his highest cortical function. All of these steps occur in the normal, uninjured brain development. When an injury to the brain occurs, however, it can have devastating effects. But hope lies within the brain. Once the diagnosis of a brain injury is made, it's helpful to work with a neurologist who is knowledgeable and receptive to innovative therapy options. However, whatever program you decide to use, please keep your family physician informed. Hyperbaric oxygen is a medical treatment which increases tissue levels of life-giving oxygen, administered by lying in a chamber where the individual breathes 100% oxygen under increased atmospheric pressure. This treatment enhances metabolic activity of previously marginally functioning cells, including brain neurons. Dr. David Perlmutter is internationally known for his extensive work in researching and educating the public through radio and television. He is recognized as a leader in the field of nutritional influences on neurological diseases and stresses the importance of a unified, comprehensive approach to treatment.
What we generally focus on in neurology are really any problem dealing with the nervous system, from the central nervous system involving the brain and spinal cord to the peripheral nervous system, which involves the nerves going to the arms and legs. I think it's important to recognize that there's a full spectrum of neurologic diseases, ranging from things such as hyperactivity disorder, or so-called ADD, all the way to full-blown coma. It's the comprehensive approach to neurologic disorders that we emphasize, and that includes utilizing things like nutritional approaches, hyperbaric oxygen therapy when indicated, sensory integration modalities, various forms of physical therapy, and these are the modalities that are useful in creating a whole comprehensive approach regardless of the neurologic disease that we're discussing. Hyperbaric oxygen therapy is really quite useful for any age whatsoever. We use at our facility the Seacrest Model 3200 chamber, and this is a chamber that's wide enough, in fact, to allow even large individuals to be treated, and further, we oftentimes have parents accompany children when they do receive their hyperbaric therapy. The real reason we got involved with hyperbaric oxygen therapy is based upon the work of others, including other physicians in this country and in Europe and abroad, that have demonstrated significant recoverability of patients, not only children with traumatic injuries or so-called cerebral palsy, but adults with trauma and stroke as well. This really is a new and very exciting therapeutic potential that neurologists really are in a key position to utilize. It really does give people a second chance, and it really makes being a neurologist a much more fulfilling vocation in terms of finally having a very important tool that we can offer to individuals. One of the fundamental concepts of hyperbarics is to get that treatment on board as soon as possible, i.e. as soon as possible after the injury is recognized, or in the case of an adult, as soon as possible following a stroke or traumatic injury. This is to say that the sooner the hyperbarics is on board, the more likely it is to limit the size of the injury. When stimulation programs are utilized, they really capitalize on the advances that we're able to make with hyperbaric oxygen therapy. In the course of treatment with hyperbarics, we're able to turn back on various neurons and allow them to become much more functional. Stimulation techniques then take advantage of those neurons and attempt to reprogram them. Children with traumatic brain injury really represent a unique opportunity for those in the field of hyperbaric oxygen therapy to really be very progressive in terms of the advantages we can offer these children. This is a type of therapy that can reestablish viability to nerves which have been compromised. Then the child is able to be placed in a program of vigorous physical therapy, occupational therapy, speech therapy, tactile stimulation, which can take advantage of those neurons and then allow them to be reprogrammed. The common teaching that once a child has a brain injury or is born with so-called cerebral palsy, that is about as good as they are going to get, we now know is simply not true. There's a lot of new and exciting information coming down the pike with reference to hyperbarics and other techniques that really allow children to have a second chance. You know, typically what happens in a brain-injured child is parents are told that the child is going to have his or her therapy at a specific therapy department. But really there's no one in a better position to be more fully accomplishing that therapy than parents. That's why it's really important for parents to become involved in the therapy and in fact continue that therapy in the home setting. They're much more attuned to the responsiveness of their child and really in a much better position than other individuals who are professionals, although obviously it's important for them to get the appropriate training from these professionals to be able to carry on that program at home. Nutrition is obviously a very key player in this whole concept of a comprehensive program. We have to have the neurons have the appropriate nutrients available to them when they're being reprogrammed and being revitalized. In addition, it's important when individuals do have hyperbarics that they have on board antioxidants, because there is a consideration that hyperbarics may in fact lead to excessive free radicals. So we always make sure that vitamins are an important part of a recovery program. The most important concept I think to take away is the fact that we need a comprehensive program. And that is that hyperbaric oxygen therapy is not the only answer, nor is physical therapy, speech therapy, occupational therapy, sensory integration, or whatever program a child may be involved in. What is important is that all of these modalities are unified into a comprehensive program, and that's where a child stands his or her best chance of having a meaningful recovery.
Dr. Richard Neubauer is recognized as a pioneer in hyperbaric oxygen therapy. An author, lecturer, and educator, he's written numerous papers for medical journals. He is also former CEO of the American College of Hyperbaric Oxygen Therapy.
There are three types of brain injuries that we deal in. One is the acute and the long-term neurologic deficit of stroke. Number two is traumatic brain injury, and number three are the anoxic ischemic encephalopathies, which include near hanging, near drowning, electrocution, cardiac arrest, carbon monoxide, and so forth. Ideally, the earlier these patients are treated, the better, because there is brain swelling. There are all types of events that could be deleted, and other types that could be slowed down. So the immediate treatment is optimum. When somebody tells somebody that there is dead brain tissue, they are dealing only with the results of a PET scan or a SPECT scan. This cannot be told with MRI, functional MRI, or MRI angiography. It takes PET or SPECT to say what is dead. SPECT scanning is the ultimate for brain death. Now, SPECT imaging is a functional scan. It tells you what the brain is doing at a point in time. Unlike MRI or CT, the images there are exquisite anatomically, but it's so important to know what the brain function is. The brain is a magnificent organ. There's a function built in called plasticity, and that is one part of the brain can take over for what another part is supposed to do. So the functional image prior to any type of intervention is essential. We use this, and then we challenge the brain with hyperbaric oxygen. And what we find is that frequently there is a change in the scans. This is reflected by blood flow, but since the tracer crosses the blood-brain barrier, it's also functional and metabolic. So we have a way of seeing what the brain can possibly do in the future. One of the major things we haven't mentioned is the nutritional application. This is something that we have to take a hard look at, particularly in the growing children. But the use of PT, OT, speech, as I mentioned, therapy, magnets, patterning, all of these things must be encouraged by the family, because it may take a number of years for these patients to get back. So although the ideal treatment would be immediate, still there is hope for the long-term neurologic deficit.
Dr. Herbert Pardell is certified in internal medicine and is the medical director of the Life Extension Foundation. His extensive research in nutrition helps us understand its significance in helping the brain to function properly.
A major factor in treating post-brain injury or congenital brain injuries or any brain dysfunction is to make sure that the patient has a proper nutrition for proper neurotransmission in the brain tissue itself. Nutrients are one of the most important things that a lot of people forget about when they look at the dysfunctional parts of the patient. They think of the anatomic things such as a limb or a movement, and the movement isn't all that's there. What's the stress in the movements and what's the problem with the movements can also be nutritionally or biochemically involved. Okay, it's important for the caretaker then not only to see to the physical correction of what the problem is, but also the biochemical correction by producing a diet and supplement program which enhances the neurotransmission in the patient's brain, and so that the brain can function properly, so those things in the extremities or the legs or even the bowel function properly. One of the important factors in nutrition would be the normalcy of the GI tract. Very frequently, children or adults especially have a problem called leaky gut syndrome. What that is a abnormality in the columnar or the cells of the GI tract, the lining, which allow leakage of large molecules which are improperly digested to get into the system and form immune antibodies. Most people don't understand that the gut is a neuroendocrine system in itself. There are tremendous amounts of neurotransmitters produced in the GI tract which affect the brain. So it's very important that the GI tract be normal, as close to normal as possible, so that these things are produced in a normal manner. L-glutamine is a very important nutrient for the nourishment of the gastrointestinal lining, the cells. It produces the food for the cell to become normal. Also, it's important for the colon, which is the last part of the GI tract, to be normal, and for it to have its proper acidity and alkalinity, because it's a place of nutrient formation, it's a place of B12 formation, it's a place where the bacteria exist. Normal bacteria have to be present for the production of normal nutrients. The vitamins should be the B complex, the water-soluble vitamins, which are the B complex, the minerals, which are going to be amino acid chelated, and the fat-soluble vitamins, which are extremely important, that have to be given along with a fatty meal. For example, CoQ10, extremely important in energy production. Energy is called ATP in the body, in the cell, produced in a little organ in the cell called the mitochondria. Mitochondria is a little factory that produces energy, ATP. It's very important that ubiquinone or CoQ10 be on hand for this transmission of electrons. The transmission of electrons then allows that mitochondria to produce ATP. So it's important that we get all our vitamins and minerals and that they're absorbed and utilized. So the GI tract has to be healthy. When the patient comes home from the hospital, if they've been used to a fast food type of diet, that's one thing that must be avoided, because fast foods are high in saturated fats and high in sugar content, both of which are detrimental to normal brain function. If a patient has a feeding tube, it's important to know where the feeding tube is. Some people have an ileostomy feeding tube, which is lower down. Some people have what we call a gastric peg, which is an upper GI area where it goes into the stomach, and that's sort of normal type of feeding. You can bypass the mouth and the esophagus, but remember, when you do that, you're going to have to be giving enzymes, because when you bypass the mouth, which produces enzymes for starches and produces the proper mastication of the food, and when you chew, don't forget, you're going to stimulate hormonal and neuroendocrine production in the GI tract. So if you're going to bypass that, you have to understand that those things may have to be replaced.
Establishing neural pathways in the brain is fundamental to an injured brain's recovery. Dr. Morris is an optometrist and fellow of the College of Optometrist and Vision Development, as well as being the state director of the Optometric Extension Program. His specialty in behavioral optometry and neurological organization programs stress the importance of the visual system in the establishment of neural pathways.
We take an emphasis in our office on visually related problems. We're obviously checking the structure of the eyeball to make sure everything's healthy, but we go one step further and check function. And the reason why somebody would go to an optometrist, especially a behavioral optometrist, would be once again to check function of the visual system. So a behavioral optometrist is not only trained, but also has the proper equipment and the expertise to be able to evaluate the function of the visual system, not just the structure. There's two different types of examinations we can do in this office. The first type is a visual skills examination. And during that period, we're going to check obviously the structure of the eye, make sure everything is healthy, there's no diseases in the eyes, there's nothing neurologically going on there. We're going to check eyesight, we're going to check for nearsighted, farsightedness, and then we'll do some functional testing. We're going to check tracking skills, we're going to check the ability to use both eyes together as a team, we're going to check focusing skills. These things are not routinely checked at the routine eye doctor's office, often overlooked, and these are some of the core problems that the child's having or the adult is having. There are children that we'll see in this office that are referred to us, and we will do what's called a developmental examination. Here we can check the developmental stages of the child visually. We all know that a child develops when you come out of the womb. You just have tools. How well you use those tools is how well you develop them. What will happen is that if the child bypasses a certain developmental milestone, or actually maybe goes through the developmental milestone too quickly, then what will happen is that can affect other systems also, and very, very importantly, the visual system. So if the child is crawling or creeping too quickly and goes immediately into walking, if the child bypasses the walking stage completely, if the child stays in the creeping stage for too long, then we set up a time delay or a time fast forward too quickly of the other systems, so that now the visual system is relying too quickly on the kinesthetic or the tactile system, or vice versa. Every system has to develop within its own time and with the help of all the other systems. A patient who's had a head injury or a stroke basically has already gone through all those stages and now has lost the ability to do that. So there's two words that we always use, habilitation, and we always hear about rehabilitation. Well, the child or the adult who has never learned how to do this is what we call habilitation. They're learning how to do it for the first time. Somebody who has gone through an accident or neurological upset, trauma, we're talking about rehabilitation. We're going to take the patient through the same stages. Even though they've gone through them before, we're going to take them through again. What happens, unfortunately, is if you don't take them through the proper stages, with the proper reinforcement, with the other systems, that patient might get better, but they'll cause a lot of adaptations. They'll cause a lot of compensations. And that's how a person does get better. After the neurological insult or trauma, what we're trying to do is obviously rule out any sort of neurological structural defects or physical defects that might be involved here, because that will limit us in our rehabilitation of the patient, whether it's a child or adult. Once we get a green light that there is no neurological insult or trauma or structural defect, then we're free to go with as much functional rehabilitation as the patient is willing to go. Home therapy is as important as office therapy. A parent who is constantly asking me, what else can I do? So that we're constantly working on nutrition, exercise, physical therapy, occupational therapy, speech therapy. This is a parent who is really concerned. And we notice there's going to be a big difference when we get on team as part of the visual rehabilitation.
Sensory input through specific body movements is essential for enhancing the injured brain's neurological function. Jean Lewis, president of Walters Rehabilitation Therapies Incorporated and president of the nonprofit organization American Academy for Human Development, has worked in the United States and abroad as a sensory motor developmentalist. Over the past 30 years, he's developed a hands-on program that can be implemented at home by caretakers, family, and volunteers to try to help enhance the brain-injured individual's neurological potential.
People with brain damage often do not have good registration of information. To treat this malady or this dysfunction, one does so passively first. This simply means that following the blueprint of human development, we put brain-injured individuals through passive movements. These passive movements are done by family members, done by neighbors, done by anyone who will volunteer a couple of hours a week of their precious time in helping that individual who is brain damaged to receive proper information. Information properly going into the brain taps into the reserve of unhurt brain cell tissue. When these movements are accomplished repetitively and over a period of time, it is our intention and it is the brain's response to begin to duplicate these movements and these pathways that we have been imparting into the system. The individual does so by beginning to move primitively or less than primitively in more advanced ways. The individual may begin to make grunting sounds or have different degrees of vocalization, or their speech may improve drastically. Personally, in my experience of working with people in coma and other people that have been profoundly hurt, I feel that most anyone will improve somewhat to significantly when the right formulas of therapy are introduced into their environment. In the beginning of a treatment program, there are different protocols of technique. One of the most basic protocols of technique for children who are severely hurt are the homologous movements. The basic homologous movements, which you are about to see, are movements that stimulate the spinal column and the medulla part of the brain. One of the first movements and the most important movement that I use in bringing people out of coma is called homologosity number 1. Therapeutically, if you were doing this homologosity number 1, cross and uncross movement to your hurt family member, you would place the person on their back. You will have one person at the head, crossing and uncrossing the hand. You would have one person at the feet, crossing and uncrossing the legs at the ankles, and you would have another person at the side with one hand at the back of the head of the individual and the other hand at the back of their knees. In the cross position, the head would be lifted so that the chin touches the chest. The arm and leg on one side would alternately cross the opposing arm and leg, and the person in the middle would fold the individual into a curled up fetal position. You would hold this position for 2, 3, 4 seconds, and then you would uncross. The rhythm for this would be cross, 2, 3, uncross, 2, 3, cross, 2, 3, uncross, 2, 3. The homologosity number 1 fetal movement, which we often call cross and uncross, stimulates pupillary constrictions in vision. This means that when you move in this position, the pupils tend to get larger and smaller. This is one of the signs of a person awakening from coma when they experience a lot of this movement therapeutically. Another aspect that this particular movement offers is in the swallowing reflex that facilitates nourishment. Another benefit of this movement is that it helps in the elimination processes of bowel and bladder. But I suggest this particular activity from 3 to 15 minutes at the time, and from 2 up to 10 sessions per day, 5 days a week. The next sequential movement to homologosity number 1 is reverse seesaw. Position-wise, both arms of the individual would be extended back and over their heads as much as is physically possible. Their head would be flat, and both legs would be straight and in alignment with the hips. This is the apart and beginning position of the movement. In the together movement, the head would be lifted chin on chest, just as in homologous 1 movement. Both arms would come down to the sides of the body, and both legs would come up comfortably toward the forehead. And then the extended position would be, the head would be flat, Both arms would be extended back and over the head, and both legs would again return to the extended and straight position with the legs in alignment with the hip. I would suggest doing this from 3 to 5 minutes, 2 or 3 times a day. Since movement is the language of the brainstem, the first parts of human movement consist of undulating patterns. These are wiggling-like movements of the spinal column. One of the techniques that I suggest sequentially is the fish tail. This is very much like the movement of the pendulum of a clock, in that the legs move from side to side, stimulating the lower portion of the back. One person stands on each side of the individual with their hand on the waist and the knee. A third person is at the feet, and it is that person's responsibility to move the legs back and forth from side to side, much like you're moving the legs from 8 o'clock to 4 o'clock positions. I would suggest doing this about 3 minutes, 2 or 3 times a day. The partner to undulating movement of fishtail is ragdoll. This involves movement of the upper torso of the individual. Position-wise, a person is at the head and a person is on each side holding the shoulder and the lower arm of the individual. If you have a fourth person, they would stabilize the hip area. You would keep the head in a position as it moves from side to side so that the eyes focus straight up or toward the ceiling. I would suggest doing this 3 minutes, 3 to 5 times a day. The next most logical developmental movement is the frog movement, the together and apart frog movement. This type of activity simply connects the medulla to the pons part of the brain in movement, but it also dips down into the spinal column, facilitating movement that is helped with the homologous 1 and homologous 2 movements, which we've previously reviewed. When doing the frog movement, a person would stand at the individual's head with both hands at the chest. Both legs would be flexed. In this position, both elbows and both knees protrude outward. Most of the times this can be done with 2 people. This is a favored movement and a very wonderful movement to help those children with learning and reading disabilities. It is also very wonderful in getting a baby who cannot crawl to begin to start moving forward on the floor. The advanced technique to frog number 1, together and apart, is frog number 2. It's the same type of movement as frog 1, except the limbs move in the same direction. If the hands are over the head, the legs are toward the groin area. If the hands are on the chest, the legs are extended, the heels are together, and the feet are spread at the bottoms of the foot. In doing the frog patterns, I would suggest 3 to 5 minutes of frog 1, followed with 3 to 5 minutes of frog 2. Try to get in 10 minutes of frog movements per session, 1 to 3 times per day. Therapeutically, the reason we brush the hands and the feet with soft brushes is to stimulate sensation or to reduce sensation. There are many areas on the palms of the hands and the bottoms of the feet that deliver information to different parts of the brain. I would suggest brushing from 10 up to 50 times per session, or brush 2 or 3 minutes about 3 times per day. Homolateral patterning on the back is the first basic pattern of getting a child to move on their stomachs. If you'll notice a newborn baby, after they finish their frog movement on the stomach, they begin to position their bodies so that one arm and one leg on the same side alternately propels their body forward. The child then advances from moving in a homolateral pattern on their stomachs to moving in a cross pattern. This simply means that the opposing arm and leg is at a right angle while the other arm and leg is straight. When we choose to pattern an individual on the back, we find that this movement is extremely comfortable for that person. They're able to see us, they're able to feel more relaxed, and we can watch the expressions in their face and make judgments on the pace at which we move the individual through this patterning process. Developmentally, we should pattern individuals on their stomachs rather than on their backs when conditions permit. Moving an individual on their stomach enables them to receive sensation as their hands and their feet come into contact with the surface on which they are patterned. If you will visualize a young baby beginning to move forward from one point in a room to another point in a room, the only way they can move forward is simply by pulling with their hands and forearms and pushing with their knees and feet in order to execute forward movement. As we grow older, we may call this the military crawl. Most people should choose to do one pattern first for a period of time before they advance to the next pattern. I would suggest patterning homolaterally on the back for 5 minutes at the time. I would suggest doing this 4 times per day. When you're patterning on the stomach, I would suggest patterning from 3 minutes up to 10 minutes at the time. I would suggest doing this pattern from 3 to 4 times per day. Keep in mind that sensations pass slowly from the surface to the brain of a hurt individual. The method of this technique is to simply squeeze the body in different positions, but squeeze fairly firmly so that you stimulate below surface tissue. By letting go, this allows the messages of the squeeze sensation to register appropriately in the brain. This technique facilitates vital sensation. Vital sensation is extremely important because it is necessary that we feel pain or discomfort for our personal protection. I would suggest doing this activity for 1 to 3 minutes at the time. Mostly 1 minute is enough, and you can do this for 20 times in 1 minute. Movement is the language of the brain stem. It is the key to unlock the wonders of the brain.
Reprogramming the Dysfunctional Brain.